The Universal Health Coverage Plan under the Big Four had three key elements: service delivery, health financing, and governance. The goal was to provide every single Kenyan with a health insurance cover by this year.
That's right. Our very own Victoria Rubadiri takes stock of the ambitious government program on this week's National Reminder.
I turn to the third element of our Big Four, and that is universal healthcare. Indeed, in our conversations, it was obvious that the cost of healthcare still stresses many families. We can end that pain by providing medical insurance cover for every Kenyan within the next 5 years.
And with that announcement began the rollout of the universal health coverage, with 4 counties selected for the pilot programs to begin the following year. 4 counties, Kisumu, Isiolo, Nyeri, and Machakos, were to be the model for a scale-up of the program to the rest of the country. The rollout would run simultaneously with the National Hospital Insurance Fund's drive to enroll more members. According to the WHO, only 20% of Kenyans have access to medical insurance, and most of that number are under NHIF. Latest figures from NHIF reveal that as of December last year, it had 10.1 million principal members. This is still not achieving Kenya's minimum target of 80% enrollment of Kenyans into the UHC program. It is likely this will take some time, as the global burden of disease predicted that by 2030, Kenya will have 60% of the population under UHC. Another goal was the gradual increment of budgetary allocation to health from 7% in 2017 to 10% this year. Well, budget allocations to health grew nearly 3 times between 2013 and 2020, from 78 billion shillings to 217 billion. It got close to 10% target in the 2018 and 2019 budgets, however, slumped significantly in 2020 and 2021. Now, besides not hitting its 10% target, the country lags behind in its obligation to meet the Abuja Declaration target of allocating 15% of the budget to health. Other financial interventions included introducing a Robin Hood tax, which took effect in late 2018, and dedicating a percentage of excise duty and sin tax to health. That percentage is not known. Well, the government also intended to reduce out-of-pocket spending for Kenyans. According to statistics quoted by the Kenya Medical Association, for every 100 shillings spent in healthcare in Kenya, 30 shillings is out of pocket. Well, shielding Kenyans from the high costs of healthcare still proving a challenge. Now, despite these existing hurdles in meeting its targets, in February this year, the government fully rolled out UHC to all 47 counties. NHIF is aiming to enroll at least 19.5 million Kenyans to the Universal Health Coverage Program by the end of this year. Well, part of that push will see a boost in uptake that will see enlisting of 37,000 banking agents, 4 banks, and mobile telecom networks, as well as SACCOs and religious organizations for advocacy. In addition, 100,000 community health volunteers will be tasked with each recruiting 20 households. Well, that's your national reminder of the week, lest you forget.